This segment is sponsored by VCU Health.
The doctor is in and you have questions, whether it's insect bites or bites from a wild animal. It certainly can be hard to know what to do in a particular situation. Dr. Ruddy Rose, director of the Virginia Poison Center with VCU Health, joins us today talking more about important tips to help you stay safe when you're out exploring. Thank you so much for being with us, Dr. Rose.
Thank you. Good to be with you.
This is a really important conversation because in that really like go moment when something happens, you want to know how to react. When should a person reach out? Should they encounter a bite by a snake or a particular type of insect?
Well, we'll start with insects since they're very prevalent and far more common in summer in Virginia. And fortunately, most insect bites are fairly self-limiting. They heal on their own. The concern would be if you're allergic to insects, and most people fortunately would know that and hopefully would have an EpiPen with them, or if the bite got infected. And you would know that by the area becoming warm, getting red, having some red streaks, and maybe even getting a fever. So those would be the insect bites that would then require some medical care, but fortunately most are very self-limiting.
So keeping your eye on those insect bites is key, and you know there's a balance there because you want to react quickly, but you're also keeping your eye on it. What about snakes?
Well, snakes are very scary. Fortunately, the non-venomous snakes are far outnumber the venomous snakes in Virginia, and we have three of those. We have copperheads, cottonmouths, and rattlesnakes. And I think the first thing I would say that if, most snake bites are in self-defense. So if we leave snakes alone, they're typically going to leave us alone. If you do happen to get bit because you don't see the animal and you get bit, first thing, don't panic. Some of the times the snake won't even inject venom into you. So if it is a venomous snake, which you can identify safely if possible by their triangular head or the heat-sensing pit between their eyes and their nose and their elliptical pupils, they may not inject venom. So unless you're really having difficulty breathing or some type of severe reaction, a call to the poison center would be the first thing to do, and the poison specialist can help you decide whether you need additional care. And if it begins to be very painful with a lot of swelling, then invariably we're probably going to refer you to the emergency department.
How quickly would something like that happen? I mean, I'm hearing you loud and clear, remain calm and see what unfolds, but how quickly could that turn?
Well, normally it takes several hours for them to really get significant. The exception would be if you have an allergic type reaction to the venom itself. And that if you have handled snakes in the past, if you've been bitten by some circumstance in the past, then you could have an immediate reaction. And there are rare snakes, some rattlesnakes, that can give you that type of reaction the first time they bite you. And that would be where you might feel like you have difficulty breathing, get dizzy, feel faint, and that would require a trip to the emergency department. But without that, you normally have an hour or two to sort of see how the bite progresses, and the medical care necessary is not that urgent.
Dr. Rose, we have about 30 seconds left, and one of the key encounters in our part of the world and when you're traveling is ticks or having a tick bite, perhaps. What are your words of wisdom there?
Well, fortunately, most tick bites in Virginia are benign. We have three ticks that have some importance. There's the deer tick or blackleg tick that's associated with Lyme disease, the dog tick associated with Rocky Mountain, and then the Lone Star tick, which is associated with the meat allergy. So typically, ticks have to be embedded for hours. So the key here is prevention. So trying to prevent a tick bite and early removal. So when you come out of the woods, check yourself carefully. And most of the time, you should be fine.
And we're just about out of time. I want to ask you quickly, because top of mind too, should you encounter a bite, is an animal that may have rabies. Is there anything that we should consider with that?
Certainly. I mean, rabies is a very serious illness, fortunately very uncommon. The wild animals associated with that are bats and skunks, raccoons, and foxes. Domesticated animals, unvaccinated, would be cats, dogs, and cattle. Again, if you do get bit by a wild animal that meets that criteria, we would suggest you get medical care. The vaccinations are very effective in preventing the illness, which is very severe if you do get it.
Dr. Rose, thanks for these words of wisdom so we can go out and explore safely and know what to do should we encounter a hiccup. We appreciate you being with us.
You're certainly welcome. Thank you.
Absolutely. We'll share a little information. If you have any questions about bites or need expert advice, you're welcome to call the Virginia Poison Center, 800-222-1222, or visit the website poison.ecu.edu. Virginia This Morning returns right after this.